Hello everyone. Hello and welcome to the Instagram Live for Dr. Shankaran's online homeopathic clinic. Oh, it's a beautiful Sunday and we hope that all of y'all are going to really enjoy this session with a very talented Dr. Gaurang Gaikwad, whom we are going to have online today very soon. And he is going to talk about hormonal disorders and the role of homeopathy, especially in curing these disorders. And so I'm sure everybody is going to benefit from this wonderful talk. And we will also have Dr. Rajan Shankaran, who will join us a little while later. And it will be a wonderful conversation this Sunday morning. Great. So what is Dr. Shankaran's online homeopathic portal? Well, it is a portal which has 4 wonderful doctors online right now who give you the best treatment from the comfort of your homes. So I think it's beautiful that especially during the pandemic, when you all want the best treatment from the comfort of your homes, you can just log on to the portal, you can take your appointment, and you will get the best homeopathic treatment from doctors that have been trained by Dr. Rajan Shankaran himself. So it is a wonderful opportunity to take this thing forward, and especially what is important is to note that these doctors have not only been trained by Dr. Shankaran, but they also follow his very special and unique method of case taking. And homeopathy, of course, helps because it addresses the individual as a whole and not just symptomatic relief, So now before much, I will call Dr. Gaurang online. Thank you. Hello, Dr. Gaurang.
Hi, how are you? How are you, Shukri?
I'm good. Thank you, Dr. Gaurang.
Thank you.
So, welcome on this wonderful Sunday, and I'm sure we're going to have a lovely conversation with you. But, before we start, I don't think I need to tell much, but I need to tell a little bit about you. Yes,
Sure.
to all the viewers who are just joining us. And what to say about the very passionate Dr. Gaurang Gaikwad, one of the most popular teachers, especially for the younger generation. Dr. Gaurang, you're actually an inspiration to many youngsters who are learning homeopathy. And he has helped them, guiding them on the homeopathic journey, which is so beautiful and so inspirational. And he's the youngest Indian homeopath to be invited to Europe to teach classical homeopathy and repertory. And his approach is a blend of classical homeopathy and advanced kingdom methods. And Dr. Gaurang has worked with Dr. Rajan Shankaran very closely over a couple of years now. And he has also worked with him, with some books that they have published, which is Synergy in Homeopathy, Synergy Synopsis, From Familia to Synergy, and The Art of Follow-Up. And not only that, Dr. Gaurang has written 2 books of his own, which are Decoding Mental Rubrics and Matera Medica of Nosodes and Sarcodes. He is also associated with the Other Song Academy, where he is teaching students and inspiring them on their homeopathic journey. So, Dr. Gaurang, can you please tell us a little more about your journey and the role of homeopathy, especially in hormonal disorders?
Okay, so first of all, thank you for having me on board, and it's an absolute pleasure and honor to be associated with this magnanimous portal. About my journey, I'm going to tell you in short because we want to talk about the hormonal disorders today.
Yes.
Yes. So I come from a very rich heritage of doctors. Both my parents are actually ophthalmologists. So I actually joined homeopathy by default. And whatever I was not interested in homeopathy in my college life, it was due to teachers like Dr. Sankaran, Dr. Vijay Vaishnav, and Dr. Shaurkar from Kolkata, who who inspired me to take up homeopathy. And just a small correction, I've been almost associated with Dr. Sankaran for last 12 years, if not more. So
Yeah.
just spending a lot of time with them, learning from them, and having my own experiences, I kind of found my way within some chaos in my life. So I'm very grateful to my teachers, and you can say homeopathy has always helped me find my own way, and that's why I'm here, just trying to give back whatever I learned.
Yes, that is beautiful, Dr. Gaurang. Really, you're giving back what you have learned, and that's such a privilege today to do that. You're giving back to society, and you're really healing a lot of people. Thank you. Yes.
But we are talking today about hormonal disorders, and as you know, Shukrita, that the disease patterns are changing. You know, the diseases which were prevalent, let's say about 60, 70 years back, and today's disorders are very different now. Almost 50% of people staying in cosmopolitan city have hormonal disorders. They have, women have polycystic ovarian disease, of menstrual issues. Men have so many other hormonal disorders, lifestyle disorders, endocrinal disorders, thyroid problems, sexual problems, um, not so well syndrome. And this is where I believe that homeopathy and lifestyle change, I'm going to add an extra word here, lifestyle change. Homeopathy and lifestyle change together has a very, very huge role here. And this is what we want to propagate here. And this is what I believe through this portal, we can help many, many patients across the world, across the globe.
Right. Right. So, in your practice, which are the commonest hormonal disorders that you have come across?
Well, I have to tell you that almost 75% of my practice is hormonal disorder. And
Mm-hmm.
very often, many patients who come to me with some symptoms, I investigate them and they come out to have some kind of endocrinal disorder. So the commonest
Mm-hmm.
hormonal disorders that I would see in my practice are the ones which are very prominent: the thyroid disorder, um,
Mm-hmm.
the polycystic ovarian disorder, diabetes. As you know, India is the diabetes capital of the world. Um,
Yes.
and now, many people, men and women, are coming out of their closet with many sexual problems, infertility, men having erection problems, women having other menstrual sexual disorders, psychological disorders. And we know that this all have a very strong basis to the emotional patterns within a person. So this is where
Right.
homeopathy has a very, very beautiful role. And that's where I believe that the more we are able to create awareness for people, patients, students across the world, the more people will benefit with homeopathy. Yeah.
Right. Can you tell us a little more about the emotional patterns that we were talking about, which affect these sort of issues?
Yes. So I'll give you one example straight away from a case that
Yes.
I can remember. Just
Right.
about few days back, I saw a girl, a woman about age probably in her late 20s, who was having a lot of menstrual disorders, was having
Right.
irregular menses, and when we kind of investigated, she had a small ovarian cyst and
Mhm.
also had polycystic ovarian disorder. So she was putting on a lot of weight. We also investigated. She also had thyroid problem. Hmm?
Right.
She was putting on weight. She had developed hirsutism, hair all over the body. She
Right.
used to feel totally indolent, lethargic, wouldn't feel like doing anything. She also
Mm-hmm.
was in so-called depression for many, many days. So when you understand these are the common symptoms that most of these patients would actually undergo. So what homeopathy
Right.
does, and it's a very unique form of case taking that we do, we try to we
Yes.
try to map we try to map the person from childhood till now, and try to understand different areas of the person, right from childhood, the past history, the family history, the different fears, the different crisis situation. We even go into understanding the dreams of a person. This is to understand the subconscious state of a person. And when we understand all of this together, when I understood all of this together at a deeper level, her main feeling was a feeling of being very, very insulted, was a feeling of put down, was a feeling of a kind of very, very traumatic kind of state within, where she felt that she was dominated, she was treated very badly. insulted, humiliated, and because of this, she probably went into a shell. And that's where these psychological patterns, this is the way she started living. She stopped working out, she started having very bad eating habits, she went into a depression, she stopped talking to people, and gradually these are the problems she started having. So this is where homeopathy basically goes right to the core, because we understand the psychological state and hormones are very connected. It's known as the PNEI axis, psycho neuro endocrino immunological axis.
Okay.
Based on that, we give a potentized homeopathy ultra diluted remedy, which can actually go to the deeper level and help the hormonal imbalance to gradually be balanced. And along with homeopathy, especially in our clinics, we also suggest certain lifestyle changes. We also suggest certain dietetic changes. We suggest some yoga exercises. Like for example, Surya Namaskar is very, very important for patients, for women and men having thyroid problems and PCOD problems. So when we suggest these kind of changes, we suggest a homeopathic remedy, we suggest some diet changes, we suggest some yoga exercises, the patient has to get better gradually. There is no chance. So that's what we try to do here, and that's why I want to invite all our all the people who are watching here and all the people who are connected to us to share this information to as many people, that there is a beautiful role of homeopathy and hormonal disorders, and we could help them. Yeah.
Yeah. So, Dr. Gaurang, we have a question by Richa, who's asking, hormonal issues therefore related to stress or what? She's wanting to know the connection, the stress connection.
Absolutely. So, yeah, Richa, hormonal disorders is not only related to stress. Stress is one factor. There are many factors. Stress is one factor. Our poor lifestyle is another factor. We are living a very poor lifestyle. We are living a very sedentary life. We are not eating well. We are not sleeping well. Sometimes we are sleeping only for 6 hours. Sometimes we are sleeping for 13 hours. For a good hormonal system, it requires a proper circadian rhythm where you decide one time in the day and you have to sleep 8 hours a day. Also lifestyle, the food that we eat, the packaged food that we eat, the processed food that we eat is not very healthy for us. Along with that, most of us, and that includes me a few years back, we don't work out, we don't exercise, we don't take care of our own body. So metabolism slows down. So stress, lifestyle issues, and I'm going to add one more thing, and that is genetic background. It also makes a difference. So some kind of transgenerational genetics also play a role. You will see someone in some village will never get affected by endocrine problems because their genetics are very different. The food that they eat is very different. The exercises they do is very different. They will very rarely have a thyroid problem. Okay?
Yes.
Many of us living in the cities with a sedentary life, with the coffees that we drink, with the burgers that we eat, the exercise that we don't do, we will have it more often. So it's a lifestyle has an important role to play.
Absolutely. So I think maybe one of the things is to go out there. I mean, from this urbanization that we are in today, we need to step out and, go into more natural surroundings, ground ourselves. Will all that be helpful also overall? Absolutely.
So this is where, our metabolism has to change, and that can be changed by 3 ways. One is the homeopathic remedy. Second is diet and exercises. And third is changing your perception about the world. What most of us, the world we see is according to our perception. Some of us may feel like a victim. Oh, why me? Why this is happening to me? Some of us may feel very low confidence. Some of us may be healing from some patterns of our past. And this is where actually homeopathy can very beautifully help.
Okay.
If we actually study Shukrita at a deeper level, a lot of today's health issues are related to lifestyle change and hormonal problems. So if we just balance these out, I think that very, very beautifully we can heal a lot of people, I believe.
Okay. That's very helpful to know, Dr. Gaurang. And we are getting a lot of questions for you. So somebody is saying that they get headaches, with migraine headaches at 4 a.m. or 4 p.m. And can that be also related to hormonal imbalance?
So hormones are basically, if you actually study them in detail, they are actually basic very small enzymes and chemicals. So everything, every probably most health issues are related to some enzymatic, some inflammation, or some slight hormonal changes. So you can point
Right.
out to it as a hormonal change, but medically, clinically, migraines are not directly written off as hormonal problems. But if you really understand a human body, everything is connected to each other. Head is connected to the heart, is connected to hand, is connected to the feet, is connected to the
Yes.
liver. All the things are connected. We really cannot separate one to another. And that's where
Right.
homeopathy is a holistic form of medicine. And that's
Yes.
the best. That's the best for everyone.
Yes. Yes. So please keep your questions coming in for Dr. Gaurang Gaikwad, and he's going to answer them to the best of his ability. And so, Dr. Gaikwad, what about thyroid disorders? Are they treatable by homeopathy?
Yes, definitely. Thyroid, most of the thyroid issues, and there are different thyroid issues here. There is something called as a
Mhm.
hypothyroid, especially where,
Yes.
one of the commonest symptoms is men, young women, and even older climactic people. You start to put on a lot of weight. You don't feel like doing anything. You started
Right.
kind of losing hair. You start sweating more. You start feeling more chilly. This is called as hypothyroidism. Then
Okay.
there is another illness. It's called as hyperthyroidism, where you start losing weight. Your eye starts coming a
Mhm.
little bit out. You start getting a little swelling here. It's called as goiter. You start losing weight.
Right.
You again go into a depression. You become very restless. Your hands tremble a lot. This is hyperthyroidism. These two
Okay.
are very common. Your hypothyroidism is more common than hyper. But there is one more thyroid problem which most of us probably don't know about, and very few
Mhm.
doctors actually clinically investigate that, and that is what is called
Yes.
as autoimmune thyroid problem. In this, you have to ask the patient, whoever has a thyroid problem, to do a blood test. It's called as the anti-TPO test. I'm going to repeat, anti-TPO. Anti-TPO just shows that there is an autoimmune element.
Okay.
So this is a kind of autoimmune thyroid issue, and in this autoimmune thyroid issue, homeopathy has absolutely beautiful result, and in other thyroid problems also. But hypothyroidism and hyperthyroidism is very well known that homeopathy has a good result. But autoimmune specifically means that it means that there is a strong stress factor. It also means
Mhm.
specifically that there is certain lifestyle changes that you need to make, and it probably has a very beautiful result. Autoimmune thyroid disorder. So um,
Right.
along with homeopathy, as I repeat, Shukrita, and we are saying this a few times, but it's a good thing to repeat that along in
Mhm.
hormonal disorders and especially thyroid, only
Mhm.
homeopathic medicine is not the way out. Homeopathy has, let's say, about 50% role, and 50% role is lifestyle changes, the having healthier diet, um, certain yoga exercises or any workout exercises, and also
Right.
one's way of perception of life. These all things, when we change, definitely healing can happen. Definitely. And
Right.
and one more thing, because many of these are currently, almost some people are watching us. Some of them are homeopathic students, some of them are
Yeah.
homeopathic followers, some of them are patients, some of them are general people who are watching.
Yes.
Many of them are probably are already taking allopathic medicines for their problem.
Yes. I
So,
was
so
just
the
going to ask you.
advantage. Okay,
Right.
so I took over your question.
No,
So
no, no.
already,
In
if
fact,
you're
I was
taking
going to ask
allopathic
you.
medicine,
Yeah.
you can take homeopathy along with that as well. And once we
Okay.
start seeing changes, very gradually, we are going to taper
Yeah.
down the allopathic medicine, and that itself you can handle. So don't be afraid. Oh, I'm already taking allopathy, or I'm already taking Ayurvedic. Can I take homeopathy? Yes, homeopathy can be taken parallelly along with whatever medicines you're taking, because homeopathic medicines are ultra diluted and have absolutely no side effects.
Yes. Yes. But Dr. Gaurang, even, can you talk about even follow-ups in this? You take the case, you go in depth. How important it is to follow up with your doctor,
Very
especially in
important.
homeopathy.
Very important. Not just in homeopathy, in anything. Follow up is the most important thing. You can get up today and you can say, yes, I'm
Yeah.
going to do a strict diet. And you eat very strictly for today and tomorrow. And then after a few days, you say, forget it, jane de. It's of no use.
Mm.
So
Mm.
just like that, follow up is extremely important. In the first consultation, we are just suggesting you a remedy, and we are
Right.
suggesting certain changes. But after a
Mm-hmm.
month, when we follow up, we will be looking at your case again. We probably may be
Mm-hmm.
increasing the dose or reducing the dose depending on how you have been. We'll also be suggesting other changes in your lifestyle, depending on what are your blocks in your life. What are the areas why you are not able to do certain exercises? Why you're not able to do certain exercises? What food habits can we change? So all these things require very step-by-step follow-up. And generally, I suggest my patients who have hormonal problem that if you take treatment for anywhere between 8 months to 1 year, you should be able to see a very good change. So I suggest 1 year of homeopathic treatment with lifestyle changes will generally cause a very good impact in your life. That I'm fairly confident about in most cases.
Wow, that is very, very encouraging to know, actually. Thank you for clarifying that. Yes. And can you talk a little bit about PCOD and infertility and what has led to the boom in such issues today? I mean, what can
Yeah.
we do about it?
Yeah, this is one of the most commonest thing. Um, in a cosmopolitan city like Mumbai, almost every, probably every, almost 30-40% of young girls, women are having this
Yeah.
problem, polycystic ovarian disease. And probably this has again to do with disbalanced hormones. Again, it has to do
Mm.
with three things: genetical, number two, stress, and number three, very, very bad lifestyle. The food that we eat, the air that we breathe, the metabolism, very bad metabolism that we have, no exercises at all. The packaged food that we eat, lot of food is pumped with hormones. For example, a lot of food substances, for example, milk is very impure. Sometimes a lot of
Yeah.
impurities are put in it. A lot of food
Yes.
items have these impurities. Some of the non-vegetarian food also are
Mm-hmm.
pumped with hormones to make it look a little
Right.
bigger, and we are eating that, and that can affect
Right.
hormones. So all these three things, genetical, your lifestyle, and stress, all these three things have a big kind of undercurrent to the polycystic ovarian disease, which is very common. And
Yes.
polycystic ovarian disease is one of the reasons for infertility. There are many
Oh,
reasons for infertility in women. Polycystic ovarian
right.
disease is one of them. There can be many more reasons to infertility. And
Right.
proper homeopathic treatment, again with lifestyle changes, is the result here. I also want to add one more thing, that in infertility, it's also important to check for the male infertility. Very often, women come to us with infertility issues, but sometimes it's
Yes.
important to check their partner's sperm counts. It's important to check
Yes.
their sexual relationship. This also needs to be checked. Very often
Yeah.
in my practice, I treat, if a patient comes with an infertility in women's case, for example,
Yes.
I will also take the history of the husband, the partner, and we will treat both of them together, like the women and the men together, and we'll investigate them
Yes.
and then step by step help them out. So
Right.
definitely, homeopathy has very beautiful kind of results in this type of cases, and that's why we encourage, and that's why we are having this Instagram live on a Sunday afternoon
Yes.
for all our friends
Right.
here, so that they can encourage,
Yes.
motivate, and try to spread the awareness of homeopathy in
Yes.
all these kind of problems. Yeah,
Yes, yes, absolutely, Dr. Gaurang, because this is going to benefit a lot of people today. And, the more we spread it, the more we kind of understand what we can do about it, and especially how homeopathy can help, and how Dr. Shankaran's online homeopathic portal is going to make it
absolutely,
so easy for everyone to just log on to the website and they take an appointment with you or any of the other doctors on the portal
absolutely,
with their specific issues, and they can really resolve a lot of their issues from the comfort of their homes, especially today when you're little apprehensive about getting out in during the pandemic. Yes.
absolutely,
So,
absolutely. So I believe that the platform that Dr. Sankaran has started is one of its
right.
kind, and it has some very high quality physicians, and some of them are my colleagues and classmates, Dr. Faiza, Dr. Shiti, Dr. Sonali. They are world class, and I really recommend that all the people who are watching make best use of this. And it's and the other thing I also believe is that it's very affordable. If you actually study the amount of time, energy, and money that a patient will spend at the end of a year, it is
Yes.
it is it is it's nowhere compared to the homeopathic treatment that we afford. So I want to tell you that it's very affordable. That's a very important line that I want to add here, because I understand in COVID times one is very kind of reluctant about the money issue. The reason why I point out to this is because hormonal problems people don't take very seriously. They feel, okay, it's not an emergency. It's okay. We'll see later. We will see after,
Right.
maybe few days or after few months. But don't do
Yes.
that. If you see there is an issue, please address it and take proper professional help in this. That's what I want to give a very important message here.
Yes, yes. Thank you, Dr. Gaurang. That really helps because
Thank
I
you.
do know personally also that there are a lot of my friends and colleagues who also we tend to, as women, try to delay these sort of treatments that, we feel it'll go away with time. But or something will happen and it'll be all right. But eventually it gets worse and then till it reaches a point where we can't take it anymore. And that's when we come to the doctor
Absolutely.
and that's what happens usually.
Absolutely. Absolutely.
Yes. So now let me please invite Dr. Rajan Shankaran and online. Yes, this one. Okay. So now we have Dr. Shankaran who's going to join us in a little bit and take this conversation further.
Sure.
Welcome, Dr. Shankaran. Am I audible, Dr. Shankaran? Yes, hello. Great, great. So Dr. Shankaran, Dr. Gaurang, please take this conversation ahead. Yes, thank you.
I think Sir, with his such a great experience in hormonal disorders, I think he should share about some of his experiences about hormonal disorders and benefits of homeopathy. I think that would be really great for the listeners who are listening.
Right.
Well, I was hearing what Dr. Gaurang was saying. First of all, Gaurang is one of my very cherished students, and he's made a very significant mark at a relatively younger age. And this is due to his hard work, dedication, and especially his sincerity to his patients. He really takes it very, very seriously what his patients are going through and helps them in every kind of difficulty. It's for this reason that he's very popular. So, in any case, I was listening to what he was saying, and what he's saying is absolutely correct that hormonal disorders are of various varieties and types. However, the modern medical treatment is to antidote or reverse these hormonal disorders by giving something opposite. So if you have got a hypothyroid, you do something to increase the thyroid. If you have hyperthyroid, you decrease the thyroid. If you have
Right.
high sugar, you decrease the sugar. So
Yes.
it's just a local correction, you can say. It is like feeding a beggar. You are not really making the body produce the hormone. You are putting it from outside, even in PCOD, in polycystic ovarian syndrome, which is basically, you see, polycystic ovarian syndrome is not a problem of the ovary. It says
Mhm.
ovary, but it's not an ovarian problem. It's simply because there is a hormonal imbalance in the body that the follicles that should normally rupture in every cycle, they fail to rupture. And
Right.
therefore, they form many cysts. And this is called polycystic. So by changing the ovary, nothing is going to happen. You have to correct the hormonal issue. And this has really no treatment in modern medicine, no long-term solution.
Okay.
So what is the solution? Instead of correcting the local hormonal issue, we
Right.
have to see the hormonal issue as a part of the entire organism. So we say the hormones are a part of a system which is called psycho, neuro, endocrine, immune system axis. This is
Right.
recognized in modern medicine. It's not my theory. But
Mhm.
this
Mhm.
psycho, neuro, endocrine, immune system axis, it simply means that our mind, our nerves, our hormones, and immune system are part of the same group. It's like a council of ministers. And basically, it's the same government. And these systems are very, very closely interlinked. What the Prime Minister says is what the Defense Minister will say, what the Home Minister will say, what the Finance Minister will say. So they follow the same policy. So we need to hear what the Prime Minister is speaking in order to understand the policy of that government and then see what can be correct. So the Prime Minister in our case is the mind. That is why homeopathic doctors give a lot of importance to understand what the human mind is saying, what our dreams, our fears, our interests, our hobbies, our relationships. We do not say that the problem starts in the mind and then goes to the body. No, 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 no. We say that the mind and the endocrines and the nerves are all speaking the same language. Can we hear this language through the mind and then treat that entire problem so that not only the hormones get corrected, but the stress levels also come down. And because stress is not caused by what is outside, but how we perceive and how we respond to a situation. So all this we study very carefully. That's why a homeopathic consultation can take up to 1 to 2 hours. Whereas if you go to an allopath and say, I've got a thyroid, hypothyroid, he can prescribe for you in less than 30 seconds because he's treating the thyroid. The homeopath is treating you. He has to understand you, know you at a very deep level. And I must say that this knowing the patient has advanced in homeopathy from time to time. And in the last 20 or 25 years, we have made such significant progress in the understanding of the patient through a method which is called the sensation method that is originated by us here. And this is one of the advances we use along with very advanced software and very advanced case taking technique and advanced processes also, which we call wise processes. So what we are doing here in Shankaran's clinic is actually following cutting edge homeopathic research. And that's what is helping us to get better and better results, because the entire effectiveness of homeopathic treatment depends on the accuracy of the remedy selection for the individual cases. And this is what we have worked on for many, many years now, and it is helping us a lot. And so that's what I have to say. And the second thing that Gaurang pointed out very correctly is that we have to also, do things along with treatment which are important to maintain our health, which includes diet, which includes exercise, which includes inner witnessing processes, which we call wise, and which also includes spiritual orientation and meditation. So when we do all of these things, and the good thing about it is that in our clinic, we have guidance for all of this. We just don't say take the medicine and come back to us. We try to guide the patient on all aspects, because this is what we as doctors also follow. We follow what we preach. And we do that, and we, it's a bad example if a doctor is smoking a cigarette and says cigarettes are bad for health. It doesn't work. So, so we follow this and we do it, and we have a lot of meditation videos online. We have videos on diet, we have videos on everything, and we guide the patient from time to time and according to the patient's individuality. Sometimes if we tell the patient everything at one time, the patient will leave our treatment. We know that. You stop eating this, start exercising, do this, do that. He say, okay, I don't want you. So we we time it when we have to gently put the needle into the banana. It has to go very gently and repetitively and make him see sense in this. So all these are the things that we like to do, and we do. And I'm very proud of my doctors of the online clinic, Gaurang, Shiti, Sonali, and Faiza, who are hand-trained and hand-picked by me, and they are doing extremely well in their own right. And I'm very, very happy about that they can provide this help to a larger
Yes.
number of patients than I can individually do.
Yes.
Sure.
Yes. That's very interesting, Dr. Shankaran.
Yeah.
That's why we all thank you for that you have created this portal, which has made it so easy for everyone, not only in India, but all over the world, to just log on and to kind of discuss their issues online. And one important thing is you can also get a free advisory call. If any of y'all do seek treatment from any of the doctors on the portal, please log on the portal and you can book a free advisory call where you can talk about your issues in short and we can guide you. Basically, even book your first appointment. And like Dr. Gaurang said, it is very affordable, it is very easy, and it is absolutely from the comfort of your homes. So it is very private and it's perfect to start your healing journey through homeopathy, through this wonderful portal. Yes. So thank you, Dr. Shankaran. Thank you so much for giving us these insights. And thank you, Dr. Gaurang.
Thank
And
you. Thank you.
yes, please continue your wonderful, the research in this, which is also happening so much together. And Dr. Gaurang, we hope to see many more books of yours on the shelves. And I urge everyone, especially students here, to please, you buy his books and even Dr. Shankaran's books. And there's so much knowledge out there. You all can really, really read, learn, expand, and it is beautiful that we have these beautiful, wonderful people with us today on this Instagram live. And thank you so much for this
Thank you,
wonderful.
Shukrita, thank you, Shukrita, for being a great host and always having this great webinars on Sundays. We are very grateful for you to do this. Thank you.
No, most welcome, Gaurang. And I would urge everyone to go to www.drshankaranhomeopathy.com and do the needful, right? Okay, see you then, everyone. Thank you,
Thank
everyone.
you.
Okay.
Thank you, sir.
Yeah.
Thank you so
Bye.
much.
Thank you.
Bye.
Bye.